Hey Falcons fans, this is Healthy ATL with Matt Ryan. I'm here with Dr. Steve Szabo, a cancer specialist at Winship Cancer Institute. Dr. Szabo, thank you for joining me. Can you tell us a little bit more about yourself?
Well, Matt, thank you for allowing me to be here. I'm excited to talk to your fans about screening for cancer. I'm a medical oncologist at Winship Cancer Institute, and I take care of patients with a variety of different cancers. And oftentimes these cancers are actually diagnosed because of screening. And because of screening, they're caught early and we can effect a cure. So screening is probably one of the most important things that we can message to the public and your fans because it really saves lives.
Emory has been the healthcare provider for the Falcons pretty much my entire career, and we have an immense level of trust for our team doctors. Can you tell us why Winship Cancer Institute is the trusted place for all Georgians to receive cancer care?
You're the quarterback of the Falcons. You're in charge of a team. When we're taking care of cancer patients and when we're screening cancer patients, we have teams as well, and they're very sophisticated, organized, use a lot of technology. We're an NCI designated cancer center. That means we're part of an elite group of cancer centers in the nation. We have a tripartite mission. The first mission is that we need to educate the next generation of researchers and clinicians to move the ball down the field for the management of cancer and make that cure. The second thing we do is we are doing research every day using really sophisticated technology. And finally, we take care of patients. We are their clinicians and the cancer caregivers for the Atlanta metropolitan area, but not just that area, all of Georgia, nationally and internationally.
So Crucial Catch is about encouraging our fans to reduce their risk of cancer through early detection and screening. Can you tell us more about what Falcons fans can do to make this Crucial Catch?
The first thing they have to do is say, I want to be screened. You have to be screened. If we screen people for cancer, we catch it early, and as I've said before, then we can cure you. The three big ones are lung cancer, colon cancer, breast cancer. We can screen for all three of those cancers. Those are three of the most common cancers there are. For average risk women to screen for breast cancer, start at age 45. Talk to your physician. Maybe it's a little earlier. Maybe you can start at 50. For colon cancer, there are multiple ways that we can screen for colon cancer. Stool tests looking for blood. DNA test looking for abnormal signatures in your stool, or colonoscopy. If we catch those polyps early, then we can prevent a cancer from occurring. If we can catch an early breast cancer, we can effect a cure. And actually, lung cancer can now be screened. We can do low-dose CT scanning to screen for cancer. When you screen, you catch early or you prevent cancer, and that's just a great thing. And we really want your fans to take that to heart. We want everybody to take that to heart.
So I think, like everybody, I have family members who have been affected by cancer. It's all of our jobs to know the facts, take care of ourselves, and encourage our family members to do the same to reduce their risks. What are, though, some of the warning signs that you can share with us that could alert people that something might be up?
The reality is we know our bodies better than anybody else. So if a woman feels a lump in her breast, I know it can be uncomfortable talking to the physician about that, but please go to your provider, go to your physician, go to your nurse practitioner. Let them examine you so that we can evaluate what it is. If you see blood in your stool, that's a warning sign. Not all the times that you see blood in the stool is cancer, but you should actually be evaluated for that. If you have a pain that doesn't go away, that's persistent, that's achy, that's not a normal thing. Please go to the doctor and have that evaluated.
With COVID and the pandemic, people might be nervous to go back into the hospital. Emory has gone above and beyond for the Falcons. I know this from personal experience, to safely return to training camp and to provide kind of a really safe working environment. What is Emory doing to make sure that patients can get back into hospitals safely?
It is safe to see your physician. It is safe to go to the hospital. There's no reason, even during this pandemic, that you should not seek out medical care if you need it. It is safe. It is not safe to allow a symptom in your body to go on and allow something bad to happen to you.
Where can Falcons fans find more information and create a plan for reducing their risk?
You can go to atlantafalcons.com/crucialcatch.
Well, Dr. Szabo, thank you so much for your time today. This was great. Really appreciate you helping us out.
Well, thank you.